Hey guys, this is Dr. Sanders with Voyage Direct Primary Care. Today I wanted to talk a little bit about a very common thing that I see in the office as a family medicine doctor: abdominal pain. The abdomen has 4 different quadrants. You have the upper quadrant up here on the right upper side, and you have the left upper quadrant, right lower and left lower quadrants, and then you have the epigastric region as well. And I just wanted to briefly talk about that because I see a lot of things. In fact, during this COVID pandemic, I've seen several abdominal pain issues as well, and I just wanted to go over a couple of those. A really common area to have epigastric pain or abdominal pain is in the epigastric region. It's right here, just under your sternum. If you feel this bone here on your body, if you go down the bone, just to the end of it, right there is your stomach. And that's right where all your food goes as it starts to digest in the very first part of the digestive tract. Things that happen there, you can have gastroenteritis, you can have gastritis, you can have ulcers, peptic ulcer disease, gastric ulcer disease, and they all affect this epigastric region. And you'll have just pain right there, cramping. Sometimes you'll have associated nausea and vomiting. Occasionally you'll have diarrhea with that as well. Very, very common. Often they're self-resolving. We just try to manage your symptoms until the gastroenteritis resolves. Sometimes we'll prescribe medicine for nausea to kind of keep that under control and prevent you from getting dehydrated. So that's just the epigastric region. In the left upper quadrant, you have your liver and your gallbladders right there as well. Classic biliary colic, which is gallstones that are kind of temporary, intermittently clogging that tract. The symptoms are right upper quadrant pain. They're worse when I eat any fatty foods or a big greasy meal, and they'll just be debilitating pain in this right upper quadrant. That's classic gallstones or biliary colic. If it's profound, I mean, that can be an emergent situation, but it also can just be something that can be handled outpatient by a general surgeon. Right lower quadrant is your appendix. And so I wanted to briefly talk about appendicitis. I just had a case a couple weeks ago. Abdominal pain that localized to the right lower quadrant. And it's often, appendicitis can often start periumbilical, which means just around the belly button. I have this belly button pain, it's weird. And then in the next day or so, it localizes to the right lower quadrant. You can have fevers, chills, those kinds of things, but not necessarily either. And so with the appendicitis, typically you'll push on the right lower quadrant and it'll be tentative palpation. And sometimes rebound tenderness. So this guy came in and he was having abdominal pain, and I talked to him over a video chat, and I evaluated him, and I said, gosh, I really need to feel your belly. Brought him in, I felt his abdomen, and he had a classic appendicitis presentation with rebound tenderness. I called the general surgeon, we got him taken care of. Left lower quadrant, here's your colon, so the sigmoid colon starts there. And often constipation can cause issues there, colitis can cause issues there, lots of problems in the left lower quadrant as well. And so just a brief overview of abdominal pain with a couple of common things. Gastroenteritis is, again, epigastric region. Appendicitis would be right lower quadrant. And then anything going on with the colon is going to be left lower quadrant. Diverticulitis, diverticulosis, constipation pain, lots of things in that left lower quadrant. And that's pretty much it as far as abdominal pain in a brief summary. Hey guys, if you found this video helpful, please subscribe to my YouTube channel. Also, if you'd like to learn more about Voyage Direct Primary Care, please visit our website at voyagedpc.com.